all the work that I was doing before March of this year has switched from face-to-face assessments of patients and tribunal hearings to online video hearings. So everything now is being done online. Yes, my practice is restricted to mental health. In fact, the last tribunal that I took part in at a hospital was on the Thursday before the lockdown was announced. So I think it was either the day before the lockdown was announced, or it would be 2 days if it was a Monday. I can't remember exactly. But within a few days of the lockdown, and it was a fairly scary experience because of circumstances, I had to walk across the hospital, large general hospital, sort of at the end of the afternoon, and it was at that point, the hospital was almost deserted, and felt as if it had sort of quite unpleasant atmosphere, as though something was going to happen. In the tribunal itself, we unusually had to consider whether or not the patient would be safer in hospital or at home. The patient was asking to be discharged home, and in fact we discharged him on the grounds that he would be less at risk at home from COVID than if he remained in hospital. And that was the sort of balance that we made, which was an unusual decision. But since then, in the video conferences that I've taken part in, I've come across a number of patients who quite clearly have deteriorated because of their isolation. So these are people who have an existing severe mental illness and who have deteriorated for a number of reasons, either directly because they've become very isolated and have had difficulty tolerating that, or because they've been unable to access their usual support from the mental health team, and have become unwell simply because they've stopped medication, or some other problem has arisen. But it's been apparent that people have experienced poor health because of their isolation at home. Well, the attempt has been to as far as possible replicate a real life hearing. The difficulties are that what's referred to as connectivity, that those people who are connecting to the tribunal software from outside a hospital tend to connect fairly easily, whereas the clinical staff and patient, who are by definition in hospital, often have difficulty connecting. So we've had quite a number of hybrid tribunals where the panel can see each other online on the screen, but the patient or the clinical staff have had to dial in and are speaking on the phone. So there are problems for patients, and to some extent for the clinical staff in accessing the system that's being used. Although actually it's a very good system and certainly superior to sort of the common video systems that are in use, like Zoom. But it's just the problem when you've got sort of often eight, perhaps 10 people trying to connect. It's inevitable that there's problems. I mean, the other problems are simply that the tribunals become very, very long. So a tribunal that would last for an hour often goes on takes 2 hours, perhaps longer even. It's not ideal, but on the other hand, it does have certain advantages. It's a lot quicker to get to and get back again.